Hello, welcome back to the channel. Today we dive into a sensitive and deeply emotional issue making waves in South Africa. Reports have come out that children of undocumented foreign nationals who sought care at state hospitals were turned away. It is a matter that touches on health, humanity, and the ongoing debate around migration policies in our country. Please stay with me until the end so you can hear the sources of this news and try to verify it for yourself. And before we get too deep into it, don't forget to subscribe to the channel so you don't miss out on more important updates like this one. The situation reportedly unfolded in several state hospitals where children, some in need of urgent medical care, were not admitted because their parents could not provide legal documentation. For many, this feels like a humanitarian crisis. After all, children do not choose where they are born or whether their parents are documented or not. They are simply young and in need of care. On the other side, hospitals are under pressure, stretched thin, and already dealing with limited resources. This raises the difficult question of who gets access to those resources and how the system can balance the constitutional obligation to protect all human life while also prioritizing South African citizens. Healthcare has long been a contentious subject in the immigration debate. South Africa's public health sector is already under strain with overcrowded clinics, staff shortages, and a lack of medicine in some facilities. When undocumented foreign nationals turn to these services, it adds even more strain. Critics argue that the system cannot keep absorbing additional pressure, while human rights groups insist that denying a child medical treatment goes against basic principles of humanity and dignity. It's an argument that often brings emotions to the surface. In communities, the reactions have been mixed. Some South Africans say the government must enforce the rules strictly, otherwise the system will collapse. Others, however, feel that children should never be turned away, regardless of the legal status of their parents. Imagine being a nurse or doctor faced with that choice in the emergency room: do you treat the child or do you follow the regulations? It's a moral dilemma that is not easy to navigate. At the heart of this issue lies the challenge of managing migration effectively. If the systems for tracking, documenting, and supporting foreign nationals were stronger, we might not see these kinds of crises. But with porous borders and many undocumented individuals living within South Africa, hospitals and other public services are left to pick up the pieces without clear guidance. The Department of Health has not officially confirmed every reported case, but activists have been calling for urgent government action. They argue that while it is important to protect the resources of South Africa, it is equally important to make sure that children in critical condition do not suffer due to the politics of documentation. The conversation is likely to grow louder as more people share their experiences, and it will be interesting to see how the state balances compassion with policy enforcement. As South Africans, many of us want our children and communities to thrive, but we also know resources are limited. This is why the debate is so fiery. People are not just talking about law, but about survival, fairness, and humanity. On a lighter note, maybe if politicians were made to sit in the long queues at state hospitals themselves, they might move a bit faster in sorting out these issues. Because as many of us know, waiting for help in a crowded clinic is already hard enough without adding more hurdles. That brings us to the end of today's update. Don't forget to subscribe to the channel for more, and remember to watch until the end to see the sources and verify the news yourself. All images used in this video are for illustration purposes only. News sources: Daily Maverick, Times Live, Health e News.